Welcome to What Makes a Successful Dry Eye Specialist, learning from the experiences of real-life patients. Who am I and why am I doing this webinar? I am Chiarelli. I'm a registered nurse with over 30 years experience working in community and hospital settings, and also as a health educator and as a nursing instructor. I'm currently a counseling therapist with a private practice providing individual, couples, and family therapy. Some of my specializations are trauma and addictions. Trauma is a contributing factor in chronic illness, so I see many clients with chronic illness and chronic pain. I have training in integrative medicine, which integrates the biopsychosocial, spiritual, and healing, and uses therapies with best evidence from conventional medicine, as well as from alternative and complementary medicine. In my personal life, I'm a wife of 31 years and a mom to 2 adult children, so that makes me a woman in my mid-50s or so, and that also makes me susceptible to dry eye disease. And yes, I'm a dry eye patient. I have 3.5 years experience that I never wanted to have. I have had a difficult and healing experience, and I'm passionate about using my experience and learning to serve others, fellow dry eye patients, as well as healthcare providers. I will talk candidly about what us patients need from our doctors. I hope it will help you as eye doctors to understand us. With understanding, you are better able to help us, and that will make your work more rewarding, and it will help us feel better. I will talk about my experiences and the collective experiences of hundreds of dry eye patients when I was a member of a dry eye support group. The quotes in the PowerPoint are from my fellow dry eye patients. They were eager to have their voices heard. As one of them said, I do hope you can get them to take notice because this is a very real problem. Putting together presentations on this topic is highly emotional for me. That emotion will come out in this presentation. I really hope it does. But you probably will not see the raw emotion that went into preparing this, including lots of tears. Tears are good. I like tears and how it makes my eyes feel. Some other dry eye patients cannot cry. For me, it's a balance. So I hope I have enough tears, but not too many tears while doing this presentation. Anyway, I'll tell you a bit about my dry eye story with these pictures. I had had annual eye exams from about the age of 8. Prior to my diagnosis of dry eye disease, I had had a bit of dryness and occasional watery eyes, but nothing to write home about. I had mentioned it to my friendly neighborhood optometrist. I myself thought it was perimenopause because I didn't know any better. In the fall of 2017, I had a viral infection, a runny nose and a cough, and also felt some eye dryness. My son also appeared to have the same infection, and he also complained of eye dryness. I remember a counseling client also complaining about this viral infection with eye dryness as a symptom. My son's eyes and my client's eyes recovered, mine did not. In the fall of 2017, I also attended an indigenous smudging ceremony at my work. I sat there listening to stories of trauma. I had just gone through a few highly difficult, even traumatic years. One of the elders talked about getting up before sunrise and walking up a hill facing east to pray and smudge. She said, you need to do this and see what happens. Okay, challenge accepted, I thought. When leaving, I shook her hand and said to her, thank you for that wisdom about prayer. She smiled and said, try it and see what happens. I will, I replied. That picture of the casita is in New River, Arizona, where I stayed when I did my sunrise walk in October 2017. That day, I also had a session with a spiritual director where I cried and cried. It felt so good. But in the evening, I sat in my rental casita wondering if I should see an eye doctor because my eyes were so painful and I had no idea what was going on. The next morning, my eyes felt better, so I did not feel a need to see an eye doctor in Arizona. But this was the beginning of months of misery. I expected something different as a result of my sunrise walk, but I got misery. That's what I got. I believe that the emotional pain years prior contributed to the development of the chronic disease I had yet to be diagnosed with. Upon return to Canada, I saw my usual optometrist. I was treated with artificial tears, hot compresses, and steroid drops, and advised to take fish oil. I kept going back to her and saying I was not doing well at all. She said maybe I need to be referred for lipid flow. It was now December. I found a LipiFlow provider in Calgary. Unfortunately, the wait to get in was so long, and I didn't think I could wait that long for some relief. I had booked a trip to Arizona for Christmas, so a week before Christmas, I had a thought that maybe I should look for a dry eye specialist in Arizona. It's dry in the desert, so there's got to be a dry eye specialist in the desert. Sure enough, I found one. But to my dismay, there were no appointments available for the week that I was going to be there. But next thing I know, the doctor himself emailed me saying he would fit me in. So in that picture, I'm in my happy, safe, healing place back in Arizona, back in the olden days when we could travel. Anyway, this doctor had equipment needed to do a proper assessment. I got diagnosed with MGD with severe gland atrophy, aqueous deficiency, and rosacea. I had noticed a few little spider veins on my cheeks, but I didn't think anything of them. Dr. Epstein's staff were wonderful. I felt absolutely cared for. They even got me a turkey meal while I was waiting for treatment. I don't know if that's their standard practice, but it sure was nice. Dr. Epstein took a lot of time to talk with me, explaining my test results. And that same day, I was treated with Blephix and LipiFlow. Then back in Canada, I was waiting for improvement and following my home care regime religiously. But I wasn't getting better. I started feeling despair. A couple of months later, I started looking for a dry eye specialist in Calgary as I had found information about IPL, and I wanted to try IPL. I found a dry eye specialist who offered IPL. Perfect. I made an appointment. I believe this doctor had knowledge and experience and expertise, but I left the appointment feeling very disappointed and defeated. During the assessment, I got moved from one staff member to another for assessments. No one introduced themselves or explained anything to me. It felt like a factory. The doctor appeared to have no interest. He prescribed allergy drops. Why? I don't have allergies. Needless to say, I never used them. He appeared to be in a rush. He said I would be scheduled for another myography as well as IPL. Then I waited to see the scheduling person. I did a lot of waiting in this appointment. The way she talked to me, I thought I was buying a new car. I remember feeling absolutely horrible when I left the office because of how I was treated and the complete lack of empathy that I felt. I'm not usually a pushover when it comes to healthcare settings, but I was feeling highly vulnerable because of how physically distressed I was feeling at the time. After that horrible appointment, I got back on my feet and ready to fight. I started shopping around for a dry eye specialist, although my options were extremely limited. I made another appointment and found that both assessment and treatment would be cheaper. This appointment went well. There was a friendly receptionist. She took payment right away, but by now I was getting used to paying for healthcare, even in a country with universal healthcare. Patients' rights were displayed at the reception desk. I really liked that. The doctor bothered to read my medical records from Arizona. He explained my assessment to me and answered my questions. I had zero oil in my eyes because of obstructed glands in the very few that I had left. I did not feel like this doctor was in a rush. I could have an intelligent conversation with him. Most importantly, Dr. Robert Mitchell could understand my suffering and offered me hope in terms of treatment. After seeing him, I saw a nurse who explained the next treatment series to me. She did some teaching, and I was happy to have another intelligent conversation. She didn't try to sell me products that I did not need, but said what I was already taking was the equivalent of what they sold. I was scheduled for Blephix and IPL with gland expression pretty soon. Was that the only thing I needed? No, but maybe I'll tell more about my story in a future webinar. So, what are the qualifications for the position of true dry eye specialist? You may already have these qualifications, or you may need to get further education or develop some of the trades that are needed before you apply. You need interest in a complex disease with frequent comorbidities. As a real dry eye patient says, one of the most difficult things for me is my complicated issues. I don't have just simple dry eye. I have autoimmune issues and glaucoma. You truly need a doctor or team that will look at the whole picture. You need ability to do detective work and identify multifactorial etiology. You need critical thinking skills, and you need a financial investment in obtaining equipment needed for diagnostics and treatment. You need skills in empathy. Remember, empathy can be learned, and empathy even helps patients heal. You need compassion for patients whose lives have been disrupted in multiple ways and who are in discomfort and pain, at times overwhelming pain. Compassion can come from understanding the impact of this disease on our lives. A real dry eye patient says, I think the most important things patients need from their doctors are empathy and being taken seriously. I can't count how many times I've not been taken seriously by a doctor or have been looked at like I'm crazy. I have a good dry eye specialist now who cares and tries her best, even if she hasn't yet helped me find a treatment that helps. And another patient says, until docs have some understanding of the tremendous effects this condition has on an individual, it is often hard to be empathetic. The lack of empathy increases our stress. You need understanding of mental health. Having experienced pain and suffering in your own life is helpful. Being a wounded healer does not mean you have to have dry eye disease yourself, although a few of my fellow patients have mentioned it is particularly helpful. But life experience of physical pain or emotional pain is a definite bonus. A real dry eye patient says, my dry eye doc is so compassionate since she is a dry eye patient herself, which really helps. But it's not a prerequisite, thankfully. You need training in trauma-informed care and ensuring all staff are trained as well. This is, in my opinion, an absolute must. We need from you stellar communication skills and effective teaching skills. We need a willingness to work collaboratively with us. You need patience and you need humility. Patients say, I need a specialist who is a partner in my healthcare. My doctor takes me very seriously and treats me like an equal, and it makes all the difference in the world. Knowing you have someone in your corner fighting for you is so powerful. And I need a caring doc who does not give up. Personally, I appreciate doctors who can answer my questions with solid information based on evidence and experience, who will listen to rational if I disagree, and who can collaborate with me to come up with mutually acceptable treatment decisions. When I say humility is a qualification, I like doctors who are open to new information and who will listen to what I have discovered that has helped me. You need the ability to see patients as a whole and apply integrative medicine in treatment. A patient says, you truly need an integrative approach as one treatment does not fit all. Because this is a multifactorial disease, the treatment must address all factors. And this involves more than conventional medicine. You need the ability to work collaboratively with other healthcare professionals. The patient states, I appreciate my dry eye specialist as he will reach out to my other doctors. Passion for continuing education and a willingness to continually update knowledge and skills is a must. This patient says what many feel. It is hard to find true dry eye doctors who are truly committed to keeping up with the cutting-edge technologies. I myself am thrilled to see how much development has happened in diagnosis and treatment of dry eyes, even since I was diagnosed just 3.5 years ago. Interest in research and clinical trials would be very valuable. There's so much we don't yet know. And you need good self-care practice. Dry eye patients can be very challenging, or let's just say difficult. Your work with dry eye patients can lead to burnout and compassion fatigue. The more compassionate you are, the more effective you are, but it also puts you at risk for losing that compassion unless you take good care of yourself and have others take care of you. I think 3 words that summarize what dry eye patients need are compassion, excellence, and hope. If you have compassion and offer hope, but don't have excellence, it ain't enough. If you have excellence, but lack compassion and do not offer hope, it ain't enough. You can't pick and choose. We need the whole package: compassion, excellence, and hope. All right. Got some water. I like moisture. All right, these statistics show that many patients are waiting for your services. And I wonder how much the current pandemic contributes to the growth. I myself have been sitting in this chair now for over a year staring at this screen. I just recently did a search of dry eye specialists in Calgary, and it was great to see more specialists in Calgary now compared to when I was looking for one. However, a frequent complaint I hear is that there are very few true dry eye specialists. It is emotional for me to realize how blessed I have been in terms of having had access to true dry eye specialists so soon after my symptoms started. I feel almost what seems like survivor guilt. How come I have received great care and treatment when others have not? I feel helpless when there are so many others who turn to me for help, but they cannot even find a dry eye specialist. Dry eye is a business opportunity, but please do not go into it for the money. More on this later. Do you have confidence in your ability to manage dry eye disease? I heard about this survey at the Canadian Dry Eye Summit. It shows that the percentage of optometrists, pharmacists, and GPs who rate themselves as a 7 or higher in the management of dry eyes. I was quite surprised at the numbers. Granted, my experience is that I arrived in this dry eye world in a severe state, and most of the patients that I communicate with also have moderate or severe disease. But I do wonder if this is a case of you don't know what you don't know. I believe that most optometrists are able to offer some treatment for those with mild disease, although they don't necessarily know how to determine if the disease is mild or severe. So if we happen to have mild disease, we might be okay. I also believe that pharmacists are confident in recommending a variety of eye drops for dry eyes and may be able to talk to you about prescription drugs. So considering their job description, that may be okay, but it's not enough. GPs may understand their limitations more. I see a GP's role as understanding the link between dry eyes and other medical conditions. Here are some quotes from dry eye patients. I believe that our GPs need to be more informed about dry eye issues. Mine had absolutely no idea. I persisted and got a referral to an ophthalmologist who dismissed me with a bottle of sample drops off his shelf. I progressively got worse until I found an optometrist who was very well informed and specialized in dry eye problems and treated me with IPL. Another patient says, dry eye seems to scare eye doctors. And another one says, I went through 8 eye doctors before I found a good one. Doctors number 9 and number 10 have helped me the most because I learned what to look for in a doctor from so much trial and error. Myself, I had already been diagnosed with dry eye disease when I went to my then family doctor to get blood work to rule out other conditions like Sjogren's. He recommended yet another over-the-counter eye drop for me. Well, he was probably trying to be helpful. It wasn't until the next visit that he admitted that he had never had a patient with dry eyes. Maybe asking about eye symptoms and asking when a patient has last had an eye exam should be included in a routine physical, like my current family doctor does. Are you screening for DED? Everyone is a suspect. The National Dry Eye Disease Guidelines for Canadian Optometrists state, given the high prevalence and variability of symptoms, almost every adult presenting for a primary care examination should be considered to be a DED suspect until proven otherwise. I would argue that every child and teenager should be considered as well because there are kids with DED. At least education is needed regarding prevention and the need for regular eye exams. The Tear Film and Ocular Surface Society's Dry Eye Workshop report states, any symptomatic disease goes through a subclinical phase in which the features of the disease are not obvious and the patient is symptom-free. DED is no exception. A real dry eye patient says, one of the things that bothers me is that I was going to an eye doctor every year because I wore contacts, and not once did he ever mention the condition of my glands. I feel if doctors were more diligent in letting patients know, we would have a better chance in caring for our eyes. This was my experience as well. My meibomian glands were never checked. I started complaining of a bit of dryness and still glands not checked. By the time a dry eye specialist that I referred myself to did proper diagnostic testing, I had major gland atrophy. So every adult patient is a suspect. and you must be a detective. MGD may often present as an asymptomatic condition with no overt signs of disease. Questionnaires about symptoms can be helpful, but I don't believe they're enough. You need to express meibomian glands in order to detect non-obvious MGD. I'm no eye doctor, but my understanding is that all eye doctors can learn to do a basic dry eye assessment, and all must refer to dry eye specialists with further tools to evaluate and treat without wasting time. Remember, I said in the beginning of this presentation that prepping this is highly emotional for me. An emotion that came up for me as I wrote this slide was anger. I actually had not felt anger that much before until I wrote this slide, but I am angry. As I tell my counseling clients, anger is on a continuum from a bit annoyed to rage and worse. I am very angry. I didn't realize how angry I am. I have quoted from your own guidelines. What is the harm done to me and many others by eye doctors not reading or following guidelines? I have severe disease that has impacted me severely. I realize that I now read guidelines and research publications on anything that affects my body because I do not have trust in healthcare professionals. I feel I have to be fully educated myself. If you do not know the type of dry eye or severity of the disease, how will you know what treatment is required? Prescribing only drops for obstructed meibomian glands is like giving Tylenol for someone with a brain tumor. Does an asymptomatic patient need treatment? I read, recently asymptomatic MGD has been reported with a prevalence of double that of symptomatic MGD in a Caucasian population. While there are limited data on the natural history of DED, symptoms do become more common with age, and individuals with MGD are more likely to report an increase in severity of their symptoms with time, all of which may support an argument for intervention. I can hear the argument that a patient without symptoms isn't going to be compliant with treatment. Yeah, there's truth to that. By the way, I hate the word non-compliant. If a patient is non-compliant, there is a reason, and the reason may not be what you think it is. So find out and then help the patient overcome that reason or provide alternative treatment options if possible. Trust me, I understand the difficulty of non-compliant patients. But is it not an ethical responsibility to present information even if the patient does not choose to follow it? And like I said, more importantly, figure out why the patient does not follow the information. Again, diagnosis is important. We need you to refer for further evaluation as needed if you do not have the capability to do proper testing. Do not treat until diagnosis is established because otherwise you don't know what you're treating. We need you to figure out the type and severity of DED, other conditions that may mimic dry eye, and remember asymptomatic patients with signs of DED. Can I manage or do I need to refer is a question that you need to ask yourself. What real dry eye patients have to say. I think meibography is crucial at the very beginning. I had severe dry eyes for over a year before I decided to find a doctor who did it. The ophthalmologist kept saying that my glands were not atrophied without checking. Then I had it done and turns out I had severe atrophy. It took us many months of wasted time with doctors who did not know the proper treatment for my daughter. This quote is a reminder that there are many worried parents trying to find help for their kids. Another patient says, some eye docs pretend to be specialists and want you to try everything I already have. I cannot tell you how many specialists have said to me, use lubricant drops, warm compresses, and put a humidifier in your home. I am about 23 years beyond that simplistic advice. Can I manage or do I need to refer? So remember, bottom line, we need prompt treatment or a referral to a dry eye specialist with the tools to diagnose and treat. Remember the saying, if the only tool you have is a hammer, it is tempting to treat everything as if it were a nail. Another bottom line, either you become a true dry eye specialist yourself or refer to someone who is. A true dry eye specialist has many tools, not just a hammer. I have read that some dry eye docs have the opposite nail problem. They have plenty of hammers, but may not know about the nature of the nail. Bottom line, proper diagnoses. And bottom line, prompt management or referrals. So many of us are suffering with so much pain and disability. So what should your office reception area, no, not a waiting room, but a reception area look like? These pictures are real. This is what some dry eye specialist reception areas look like. You can recline and get a hot compress on your eyes while you enjoy a glass of wine or a cup of tea by the fire. Other features. They have products that they sell on display on shelves with a sign saying they continually research to find the most proven brands of treatment on the market. They have educational posters on the wall and a poster that states, "We commit to listen, diagnose, educate, treat the cause, evaluate progress for each diagnosis, increase treatment aggression if needed, and simplify a routine once stabilized." This is what patients can expect from their eye health providers. They also have a poster that says that if a patient wants to make real progress, they need to engage and invest in their treatment, including making the needed lifestyle changes and being consistent in home management. This is the patient's responsibility. Besides relaxing by a fire with a glass of wine in hand and a hot compress on eyes, what else helps with good first impressions? Prompt appointments. I do understand that we need more dry eye specialists to accommodate all the patients. Convenient scheduling. It never ceases to amaze me how patients are expected to fit into a doctor's schedule instead of doctors understanding that it is already difficult for us to deal with expectations of life while managing a disease. Telephone triaging and advice. A real patient says, having office staff that is available to either answer questions or get the answer for the patient is key. Like I said, we need a comfortable, welcoming office environment. Your commitment to patients displayed and patients' rights and responsibilities displayed, as I already discussed. Friendly, welcoming front desk staff that makes us feel like we are customers, not a nuisance. Appointments running on schedule. It shows respect for our time and recognizes that medical appointments are yet another difficulty caused by our disease. We need adequate appointment time. A fellow dry eye patient said, "The most important thing is to not rush dry eye appointments. My doctor spent 2 hours with me at my first appointment. I didn't feel like I was in an assembly line like I did at other doctors' offices." We need staff who introduce themselves, their name, occupation, what they are going to do and why, as well as asking permission prior to. A fellow dry eye patient said, "I also think that the staff dry eye patient or a dry eye doctor hires is critical. They need to have that therapeutic relationship with the patients too. Personalized treatment is a must. We don't like to be numbers and shuffled from one person to the next. Avoid unnecessary protocols, procedures, and policies that make us feel like just a number." A fellow dry eye patient said, "At some offices, you feel like you are being rushed through a cattle call. My dry eye doc now does not do that. I have tons of face time with her." As for me, I wrote in my journal once that the technologist who did my BleFX was caring, empathetic, and reassuring, which was worth the dollars I spent. To make our lives easier, you could have quality products available for purchase in your office. E-commerce would also be convenient, as well as a list of products that you do not sell and where to purchase them. Going back. This is what I posted on Facebook about my frustration with finding products. Feeling disappointed. Another rough week. I have been trying to advocate for myself. I have been using a product that I got in Arizona that is helping, but I'm afraid I will run out before my next trip. It is an American product and not available in Canada. So today I was trying to find a Canadian equivalent. Pharmacist says, we have something similar available in Canada, but it is not pure and not natural. Maybe you could order the American product online. Oh, but you can't, because Health Canada won't allow it. I walked out of the pharmacy into the bitter cold and thought about getting on a plane. Guess what that product was? Hypochlorous acid. Let's talk about money. Here are some quotes from dry eye patients about the cost of dry eye. Most dry eye patients travel and spend a lot of money trying to find a doctor that is actually vested in the disease. I feel they only care about how much money they will make. This life-changing diagnosis should not be approached as a money-making prospect. It is frustrating how many optometrists set up dry eye clinic because it is a cash cow. I don't want to be seen as a dollar sign in the specialist chair. Bottom line, we don't want to be treated or seen as cows. There are several reasons why a healthcare provider would do that, and I believe it is important to monitor yourself. If you do not see your patient as a human being in distress who has turned to you for help, ask yourself what is going on with you. If you see a patient as a dollar sign, ask yourself what is going on with you. As a counseling therapist, I know that when I start losing compassion for clients, start giving advice so that they'll just do what I say and be fine, as if that works, or start figuring out how much money I make, I am burning out and probably getting compassion fatigued. I am not good to my clients. I recently had a vacation on a ranch where I saw lots of cows and very few people. I came back refreshed, renewed, rejuvenated, and again effective as a counselor. I also know that if I don't have adequate knowledge or skills to treat, I tend to lose compassion and definitely don't feel good about myself as a therapist. So another bottom line, know yourself and your limits. Get the resources you need to be successful. That may be equipment, products, staff, further education and training in management of dry eye disease, training in communication, empathy and trauma-informed care, and work-life balance. When you are successful, as patients benefit. Thank you for listening to us, and thank you for attending.